Hello everyone, we are from BSN1B, Group 3, and today we're going to be discussing the guidelines in conducting health assessment. That would include preparing the patient, preparing the equipment, preparing the environment, and the aftercare.
Hello ma'am sir, so for today, I'm going to assess or examine you to know if there's any abnormalities or unusual findings during the examination and to aid them as early as possible only if there's any. And I'm going to provide you your privacy so you'll feel comfortable. And don't worry, all of the information gathered will be highly confidential between the nurse and the attending physician. And this examination is painless, so before we start, you can empty your bladder so you'll be relaxed during the examination. So we can assume that we have elderly patients. We have to have a lot of patience, and we also have to observe any physiological changes because of their age. And if we have any religious patient, we have to know their culture, their traditions, so we'll have to know the do's and don'ts. And we also just have to expose specific body during the examination by draping. And there are required positions that the patient will do to feel comfortable during the assessment. And we can also ask them how they want to be addressed, like Miss or Mrs.
The physical assessment frequently requires various positions. We must consider the client ability, their physical condition, energy level, and age. Position may be uncomfortable or embarrassing, and the assessment is organized to minimize changes. First, supine. Leech's position. Jackknife position, also known as basket, is wherein the patient's abdomen lies flat on the bed. The bed is scissored so the hip is lifted, and the legs and head are low. Prone position. Sims position. Trendelenburg's position involves lowering the head of the bed and raising the foot of the bed of the patient. The patient's arms should be tucked in their sides. Reverse Trendelenburg's is a patient position wherein the head of the bed is elevated with the foot of the bed down. It is the opposite of Trendelenburg's position. Fowler's position. Orthopneic or tripod position. Lithotomy is a patient position in which the patient is on their back with hips and knees flexed and thighs apart. Lithotomy position is commonly used for vaginal examination and childbirth. Lateral position. For draping, drape should be arranged so that the area to be assessed is exposed and other body areas are covered. Exposure of the body is frequently embarrassing to clients. Drapes provide not only a degree of privacy but also warmth. Drapes are made of paper, cloth, or bed linen.
Next is the instrumentation. We need to make sure that all of the equipments needed are clean, in good working order, readily accessible, and frequently used equipments are set up upon trays ready for use. Next are the examples of the instruments. Tuning fork. These are used to assess hearing. Vaginal speculum, used to examine vagina and cervix. Then, cotton applicators. These are used for specimen collection. Then, lubricant. These are used to reduce friction. Gloves, used to avoid infection. Okay. Tongue depressor or tongue blades. These are used to examine the mouth. Pen light, mostly used to assess eye constriction. Nasal speculum, it is used to examine the nose. Ophthalmoscope, used for assessing the eye. Then otoscope, it is used for assessing the ear. Percussion hammer is used to test reflexes.
And the next is pulse oximeter. It monitors blood oxygen levels. Scale with height measurement rod. It weighs and measures height accurately. Specimen container. It stores samples securely. Sterile swab. It collects clean samples for medical analysis. Stethoscope. It listens to internal body sounds precisely. Tape measure. It measures body dimensions with precision. Thermometer. It checks body temperature for health monitoring. Wristwatch. It tracks time and health parameters. Lastly, sphygmomanometer. It measures blood pressure.
The time for the physical assessment should be convenient to both the client and the nurse. Make sure that the environment needs to be well lit. Equipment should be organized for efficient use. The room should be warm enough to be comfortable for the client. And lastly, you should always provide privacy for the patient.
Cultural background of the client should be taken into consideration. Culture, including customs, beliefs, and values, can influence how people understand health concepts, how they take care of their health, how they receive medical advice, and make health decisions. People can be part of more than one culture, based on their racial, ethnic, religious, political, gender, or sexual identity, as well as their age, family, composition, what language they speak, where they were born, where they live, what their occupation is, and other factors. Respectfully ask patients about their health beliefs and customs, and note their responses in their medical records. Address patients' cultural values specifically in the context of their healthcare. For example, I would like to be respectful. What do you like to be called and what pronouns do you use? As well as, tell me about things that are important to you. What should I know that would help us work together on your health? Culture, age, and gender of both the client and the nurse influence how comfortable the client will be and what special arrangements might be needed.
The patient has pronounced dead by the doctor. And before we start the aftercare procedure, we must always start by praying for the soul of the patient. Then after that, put the patient in dorsal position. Then, put a small pillow under the head of the patient. Then after that, straighten the body of the patient. Then after that, look if the patient has any dentures in the mouth. So the patient does not have any dentures. Then after looking in the mouth, remove all the appliances in the patient, like this one. Then after removing, if the eyes and mouth are open, we need to close them. Then after closing them, look the eyes of the patient and bring the upper lids down and put gentle pressure Then after looking in the eyes, look for the mouth of the patient. Then bring the jaw together by using this rolling towel. Put under the chin. After putting the towel, Miss Ava will do the next procedure.
Thank you, Miss Mika. Now, on this next step, we will remove the extra bed linen and camisa on the patient, and we will leave a one sheet for the body later to cover. So now I will remove the camisa of the patient. Now, we will use a Lysol solution to rinse the body with towel. We will change the patient's surgical dressings if there's a surgical dressings of the patient, and we will pack a cotton on the anus, and if the patient is female, we will also pack a cotton on the vagina. Like my patient here, she's a female, and if there's any discharge on the nose or on the mouth, we will also pack them with a cotton using these forceps and cotton. So I will do it now to my patient. Next is place a diaper on the patient. And next is place the full hands of the patient over their chest. Pad the wrist with the cotton. And tie them together, the wrists, using a bandage. Here, I'm using a gauze bandage to tie the wrists together. After tying the wrist of the patient, attach a one tag on the wrist of the patient. Next is tag also the ankles with the cotton and tie them together using a gauze or bandage. Next is put on the shroud on the patient and cover them with bed linen sheet. After putting a shroud on the patient, we will put a tag at the center of the patient and we will cover the body. And now the body is covered. We will notify now the head nurse, or we will call the messenger to take the body of the patient to the morgue.